Welcome. Thanks for watching this dairy video brought to you by Dairy XNet. In this video, Dr. Ron Erskine joins us to discuss blanket and selective dry cow therapies. If you'd like alerts on new articles, videos, and resources, be sure to check out the video description below to follow us on Facebook and Twitter, or sign up for our newsletter. And don't forget to subscribe to our channel here on YouTube. Today's presenter, Dr. Erskine, completed his DVM at the University of Illinois. Following private practice in Pennsylvania, he gained his PhD at Pennsylvania State University. Dr. Erskine is currently on faculty at Michigan State University and serves as a professor and dairy extension veterinarian in the College of Veterinary Medicine. His research focuses on bovine infectious disease, especially in mastitis and milk quality, and he is the project director of a 5-year multi-institution USDA National Institute of Food and Agriculture funded project to reduce mastitis and antibiotic use in dairy cattle, which focuses on employee training and milking efficiency.
Today, we're going to talk about selective dry cal therapy. And the easiest way to discuss this is to realize it's complicated. It may be for some herds and perhaps not for others. What we will do is just try to give a brief overview of dry cal therapy and what are perhaps some of the options that dairy producers can approach this very important management tool. In brief review, we know that when we look at when new infections during lactation occur, many of them occur at specific points in the lactation. One is soon after calving, when cows are trying to go through their transition and may have some immune impairment. However, it's also important to realize that another high-risk period for new infections during the lactation cycle is soon after a cow dries off. In fact, in some herds, this may be as important as the after calving or transition cow. Historically, and over many years, we have used dry cow treatment or blanket dry cow treatment, which is infusing antibiotics up in all quarters of each cow at dry off, as a means to both cure infections that the cow picked up during lactation, but also to reduce new infections at drying off. And when herds apply this technology or dry cow treatment for dry cows, many herds realize that as their cows calve in the next lactation, there were few infections and fewer or less clinical mastitis. In fact, even though many of these studies were done back in the 1970s, 80s, and 90s, even a recent project in which over 600 dairy herds were surveyed to find out what kind of management or mastitis management practices that they apply. Herds that use blanket dry cow therapy along with internal teat sealants and not using water during milking and ensuring that they had good compliance with their milking protocols all had less mastitis or lower bulk tank SMAC cell counts than herds that did not do these things. Thus, even in this more modern viewpoint of blanket dry cow therapy, there still is an important part or important tool for many herds, and it is associated with lower SMAC cell counts. And yet, with increased interest of trying to reduce antibiotic use in dairy farms, part of it is for economic reasons, part of it is over concerns over antimicrobial resistance. Are there ways that we can relook at blanket dry cow therapy and maybe reduce some of the use in cows or in herds and try to select or hand-pick cows that we treat rather than try to treat all cows? So what I will do is to just give a brief overview of some of the studies that have looked at selective dry cal therapy. And with the approach once we lay out what has been done, to try to summarize some of the important things that must be done if a dairy manager or herd owner tries to put a selective dry cal therapy into their program instead of blanket dry cal therapy. In this study, as you look at the table, there was an attempt to try to select cows who would be suitable for not treating with antibiotics at dry-off based on somatic cell count. And different styles or approaches to try to identify these cows were made. The one that worked the best is highlighted in the blue font, in which cows that did not have a somatic cell count greater than 100,000 cells per ml for the last 3 test dates before drying off were deemed to be probably not infected, and this was used as a potential criteria to select these cows to not treat them. Conversely, all the cows over 100,000 would still be treated with dry cal therapy. The important thing to note that no matter which threshold or which approach that this study looked at to try to select cows not to treat, at best only got an accuracy of 72%, meaning that they were correctly identifying an infected cow or non-infected cow only about 3/4 of the time. When comparisons were made between cows who got no dry cal therapy or no DCT on the bottom or dry cal therapy, you can see that in this case the percent of cures was different. Cows that received no dry cal therapy overall did have a lower cure rate over dry period. That is, if they had an infection at dry off, they were still infected after calving. It did differ a little bit whether or not the cows received internal teat sealant or did not. In fact, when cows received dry cal therapy in combination with internal teat sealant, the highest cure rates were achieved. The other important aspect of dry cal therapy is to prevent new infections. This was done by these researchers to collect 2 milk cultures after calving. Again, overall, the no dry cal therapy group had a higher percent of their cows that were newly infected. That is, they were not infected at dry off, but now were infected after calving. And again, interestingly enough, the internal teat sealant, when combined with dry cal therapy, had the biggest impact or best beneficial effect. In another herd done in the Netherlands, over a large number of herds and number of cows, again, somatic cell count was used as a criteria to try to determine which cows should be treated with dry cal therapy and which should not. In this herd study, any cows who were in their first lactation but had a somatic cell count at dry off less than 100,000, very likely not to be infected, were not treated. There was a higher bar for older cows. In this case, an older cow had to have a somatic cell count less than 250,000 in order to be included in the non-treatment group. What was intriguing in this study that each cow was split in that some of her quarters received dry cal therapy and some no dry cal therapy, and there was no internal teat sealant in any quarter. In other words, they were able to compare within cow. What these researchers did find that antibiotic use, as done on a daily dose basis, was decreased by 85%. That is, if they used the somatic cell counts as a threshold to determine who should be treated or who not, at the levels based on lactation, there was quite a decrease in antibiotic use. However, systemic use of antibiotics after calving was almost 2 times higher in the non-dry cal therapy cows. And we'll come back to that concept in a minute. In this study as well, again, using SMAC cell counts as a threshold for determining which cow got treated or not, that the no dry cow therapy group were 1.7 times more likely to have clinical mastitis in the first 100 days of milk, were significantly more likely to be infected at calving, and 14 days in milk, and their SMAC cell counts were slightly higher, although not statistically so. There were significant differences, especially for the non-dry cow therapy versus the dry cow therapy group for most of the gram-positive organisms such as Staph aureus, Strep uberis, and Strep discalactia, as well as E. coli. One critical thing in this study was that antibiotic use was measured as an animal daily dose. And what is that? That's the amount of antibiotic that a cow would receive, whether it's systemic or intramammary, that would equate to a dose per day. For instance, in a dry cow tube, one dry cow tube equals one animal daily dose. And thus a cow receives 4 daily doses when she is treated as a dry cow in all 4 quarters. This can be a little deceiving, however, because when one looks at systemic use, also, even though a larger amount of drug is used, that still counts as a daily dose. And remember, in this study, there is almost 2 times as much systemic use after calving in the non-dry cow therapy cows. And so, for instance, if a cow is treated at dry off, she receives, on average, between 4 tubes, about 400 milligrams of drug or antibiotic per cow. That is 4 animal daily doses. If, however, we think that a cow who's not dry cow therapy is almost 2 times as likely to have clinical mastitis or to receive systemic drug use, that can be a little deceiving in terms of total drug use. For instance, if a cow receives ampicillin, which is a commonly used drug for a variety of reasons, but could be for mastitis, then each daily dose of ampicillin is actually in terms of total grams. And if she receives that dose of drug for 3 days, she will receive 18 to 25 grams of total antibiotic. That only counts as 3 animal daily doses compared to 4 animal daily doses if she's dry cow treated. But as you can see, she may be treated with 25 grams of antibiotic and only 800 milligrams if she's dry cow treated. This then can be a little deceiving when we talk about reduction of antibiotic relative to dry cow therapy. Finally, the last study I want to talk about is a Canadian study in which, once again, they only selected herds that had a bulk tank SMAC cell count below 250,000. In other words, picking herds that were better managers in mastitis control are probably more suitable, or more suitable type of herd to consider selective dry cow therapy. Once again, also, cows who were to be considered for selective dry cow therapy or not to be dry cow treated had to have a SMAC cell count at drying off of less than 200,000. Also, in this study, all cows were infused with an internal teat sealant. What made this study different than the 2 previous studies that relied only on SMAC cell count as their threshold for selecting treated versus non-treated cows is that they also included an on-farm culture or bacteriology from a composite milk sample. Thus, cows not only had to have a low somatic cell count, as in the previous studies, but also they had to be negative on a bacterial culture of milk. With this greater selection process, or gave better discrimination to pick truly infected cows from non-infected cows, this study did succeed in demonstrating that selective dry cow therapy may be beneficial, or at least certainly a possible option. There was no difference when these cows were followed for 180 days in milk in terms of milk production, SMAC cell count, clinical mastitis, or new infection rate or cure rate by 18 days in milk. Thus, selective dry cal therapy was successful in this study, but they included on-farm culture in addition to only selecting cows not to be treated that had low SMAC cell counts and used internal teat sealant. It is important to note that the median herd size in this study was 75 cows, or the range was 44 to about 250 cows. Thus, larger dairies that may also have employees as part of their program to dry cow treat cows or do cultures will have to take this in effect, especially employee training. So let's summarize those studies. And this is by no means meant to be a complete review of all publications, but I think it drives home pretty important points. One, if you're going to try selective dry cal therapy in your herd, you need a way to identify potential cows not to treat versus those cows that should be treated. If you think a cow's infected at dry off, she needs to be treated. When we look at the studies that were done in Europe and a previous study in Ohio, where pretty much the selection was based on somatic cell count before drying off, as you can see in the red font in this table, that sooner or later it may not be the best way to do that. Depending on the study, there may have been increased risk of clinical mastitis or antibiotic use done after calving, or potentially increased risk for new intermammary infections or decreased cure rates. I think the Canadian study best demonstrates that if selection is going to be made for trying to identify the cows that don't need to be treated, you're probably going to have to include not only a measure of SMAC cell count or inflammation, but culture at the time of dry off as well. So let's summarize some of the practical aspects then based on these studies. And there are three important things that you need to consider if you are going to try selective dry cal therapy in your herd. One, you need a way to identify and monitor infected cows. For instance, somatic cell count or bacterial culture, or for some herds, they may have conductivity built into their parlor system. The important thing here is that you not only need to identify those cows that you may or may not treat at dry off, but you must also be able to monitor any changes in your herd in these cows after calving. It's not enough just to identify the cows that you may or may not want to treat, but you have to follow the impact of your decision. So as an example of monitoring the impact of dry cal therapy or going to select dry cal therapy, here are a range of herds, about 150 herds in Michigan, who are on DHI SMAC cell count, that is individual SMAC cell count for cows. And this is a breakdown of a distribution of herds who, based on the percent of cows who were infected over the dry period. Now, what do I mean by that? These would be cows who had a low SMAC cell count at dry off that would be below 200,000 or a linear score of 4, who at their first test date now have an elevated cell count or greater than a linear score of 4. We could argue about whether or not the infections occurred during the dry period or early lactation, but this is a monitor, especially if it's tracked in herds month to month, to give a sense or an idea of what's going on in the dry and transition period in my cows. And herds that dry cow treat, blanket dry cow treat, typically have lower infection rates during this period than herds that do not. And additionally, herds that use internal teat sealants tend to have lower infection rates compared to herds that do not. As you can see, the average is about 12 to 15% for most herds. That is about 12 or 15% of the cows who have a low SMAC cell count on dry off will now have a high one during or at their first test date. Many herds can get below this, and some herds are over that. The important point to make is that not so much as a comparison where your herd is, but if you choose to make changes in your dry cow program, for instance, Select Dry Cal Therapy, you need to monitor this number and know the proportion of cows who not only are calving with a high SMAC cell count, but those proportion of cows that changed from a low SMAC cell count to high cell count. This, in addition to clinical mastitis and early lactation, are important tools to follow if you choose to select or to go with the management plan of Select Dry Cal Therapy. This is important because we know that cows that have a high SMAC cell count at calving or soon after suffer substantially greater losses than those cows who are infected later in lactation. In this study of over 164,000 cows in western dairy states, cows who had a DHI test date on their first test date, or linear SMAC cell count score greater than 4, had nearly 1,600 pounds less milk at 305 days, 3 times more likely to have clinical mastitis, 3 times more likely to be removed or culled, and an increase in their days open compared to cows who had a low SMAC cell count score at their first test date. Also, cows with clinical mastitis were 2 times more likely to be removed, whether you looked at 60 days of milk or 120 days of milk. This is why, if you make changes in your dry cow therapy program, you need to track your fresh cow subclinical mastitis, not just clinical mastitis. It should also be pointed out that clinical mastitis that occurs in the first 30 days in milk oftentimes resulted from an infection that occurred during the dry period. And in this study, the cost of clinical mastitis in an early lactation cow is quite substantial and greater than a cow later in lactation. This study suggested as much as $440 are lost on average to every cow who has a clinical mastitis in the first 30 days. Again, this is an important tool to monitor after calving for any changes done in your dry period. Here's a herd that SMAC cell counts are being tracked monthly, and you're looking at the percent of cows on the vertical axis or the left axis. What's important to look at are the red and green lines are the percent of cows that had a high SMAC cell count greater than 4 at calving over a period of a year, 2 years. The interesting one is the black line in the boxes. That shows you the percent of cows with a new infection over the dry period that we talked about earlier. That is, they had a low SMAC cell count at dry off and they were above or 200,000 at calving. You can see in this herd there has been a steady decline for about the past year if you look from November 2015 to November 2016. Interestingly, this herd started using internal teat sealant. And what this graph is trying to show is that it's important to monitor change anytime you make a change in the dry cow program. This herd could look at their records and say that their change was a positive effect on their overall udder health at calving. Again, any changes to selective dry cow therapy should be monitored as well. So if monitoring and selecting cows at drying off is an important tool, such as with SMAC cell counts or culture, what else do you need to consider if you're going to select a dry cow therapy? One is to do whatever you can to optimize the immunity of the dry cow or her host defenses. It is interesting. There have been studies that have linked the amount of milk that a cow is making at dry off with risk for infection at calving. The greater the amount of milk that a cow is producing at dry off, the greater chance she has of being infected both during a dry period and at calving. Canadian studies suggested that cows who were producing at least 21 kilograms of milk, or about 45 or 50 pounds at dry off, were 2 times more likely to have an open teat canal throughout the dry period as compared to lower production cows. So, one tool may be to consider, how can I reduce milk production in that cow the last few days before drying off to help her involution? Transition cow management, as any dairy producer or manager knows, is a critical part of a dairy herd health program. Cows who are more at risk due to negative energy balance also have an impaired immune function, and as well will have greater risk for clinical mastitis. There are products such as Imrestor, newly on the market, that is supposed to enhance immune function, or core antigen bacterins, such as J5 and JVAC. It's important to talk with your veterinarian about these options, because this will have to be tailor-made into each herd program. Finally, probably perhaps most importantly, dry cal therapy is only as good as how well we reduce the exposure of bacteria to the teat end, both as a dry cow and as a pre-fresh or a transition cow. If you remember in the Canadian study, one of the things that was done was the use of internal teat sealant. This can be a very important tool to help reduce new infections during the dry period. If infusions are going to be made of any kind on a cow's teat, aseptic cleaning is a must. There are videos available on a website for the Quality Milk Alliance, a USDA-sponsored project, both in Spanish and English, on how to help train how to do a proper infusion technique. As you can see in this photo, the one on the left, the cleaning of the teat is being done with the typical small pledget that oftentimes comes in a box of the tubes, and on the right, a larger alcohol wipe. If you make a job easier, it's likely to get done better, and I would suggest you consider using larger alcohol wipes. And of course, what is the environment of the cows? How well are we doing to keep the cows clean, dry, and comfortable? If we put dry cows in an environment that is not as conducive to keeping udders clean as it is for lactating cows, we are increasing the risk of infections. And this should strongly be considered if selective dry cal therapy, or that option, might be done in a herd. Udder hygiene scores are, for instance, an excellent example how to evaluate hygiene, and should be done not just in lactating cows, but in dry and pre-fresh cows as well. So in summary, if a herd manager or dairy producer wants to consider selective dry cal therapy as one of their tools, as compared to blanket dry cal therapy, the 3 rules that must be applied are to identify and monitor infected cows, both at dry off and during early lactation. You need to consider all you can do to optimize the immunity of the udder. And finally, you cannot overlook the importance of reducing exposure. Thank you.